Most clinics and medical facilities have incorporated a one-on-one model of patient-provider interaction. The problem is that this model does not allow providers to consult with other healthcare givers and then follows the patient's progress as part of a holistic shared care plan. The model is rigid and makes the data silos which prevent collaborative efforts for positive healthcare outcomes. The global blockchain in the healthcare market is expected to grow at a growth rate of 63.8% and reach a value of $5.61 billion by 2025. Most human services innovation frameworks start a patient's medicinal services travel from a visit to the specialist or a doctor's facility. Here, the patient is enlisted into their nearby clinical framework, for example, an EMR electronic medical record, PASS patient registration system or GP general practice system. Patients are shoppers, and their human services travel includes numerous individuals and administrations who are not ready to add to the social insurance benefit conveyance process adequately on the grounds that the procedures of medicinal services benefit conveyance are broken and divided. It is ending up more obvious that well-being and essentialness administrations can likewise assume a noteworthy job in patients' social insurance results. Introducing the dClinic platform provides for a shared care model where the patient is at the center of their care. Care is provided by care team members who could be providers, clinicians, specialists, organizations and even family members. dClinic puts the patient at the center of their care and beaks through the brick walls that often constrain their access to care. dClinic also allows the consumer to contribute to their own shared care plans through targeted surveys and wearables. dClinic uses blockchain to assist and reward consumers for their participation and adherence to their care plans. dClinic has the potential to save lives and reduce healthcare costs. Healthcare technology adoption is on the rise, but many providers have reached a critical juncture at which they must begin implementing healthcare IT or be left behind. Healthcare technology gives care providers the ability to streamline processes and offer personalized care with more efficiency. The intersection of healthcare and IT is transforming the quality of the patient experience. When you think about how many different healthcare facilities that any given patient might visit in a year, doctor's office, pharmacy, hospital, etc., anything a provider can do to modernize and improve patient care is a step in the right direction. Continuous technological developments in healthcare have saved countless lives and improved the quality of life for even more. Not only has technology changed experiences for patients and their families, but it's also had a huge impact on medical processes and the practices of healthcare professionals. Let's look at the latest technological innovations and the benefits they bring to both patients and professionals. Enhanced patient care. Improved public health, ease of workflow, lower healthcare costs. We can't deny that there are many advantages of technology in healthcare, but as with all tech breakthroughs, there are some issues to be worked out. Despite the obvious dangers, the impact of technology on healthcare is overall positive, with the benefits far outweighing the disadvantages. dClinic solves the problem. Speaking of health, dClinic intends to present an innovation that will make health costs more affordable. dClinic and its experts, after working for many years with providers, governments and healthcare organizations, recognize that a more forward-thinking healthcare platform needs to be established to break down the traditional barriers of one-on-one. Core features. dClinic health coins have value from day one. The consumer can help drive this dClinic healthcare value proposition and be rewarded by engaging with dClinic. dClinic puts the consumer at the center of their healthcare by driving all transactions via their shared care plan. dClinic empowers the clinicians and care team members by allowing them access to the correct consumer data. Consumers can meaningfully interact with their care plans because the care plans are represented in consumer-friendly terms and non-clinical language. Our choice for clinical modeling also allows language-agnostic care plans. Contributors to the shared care plan and therefore potential health coin recipients will include consumers, clinicians, caregivers and family members. Contributors to the consumer's care plan will get financial and healthcare rewards. dClinic's platform is blockchain-enabled and rewards all actors. Everyone benefits by participation and adherence to the care plans. Reasons we choose blockchain. We designed this platform to run using blockchain technology as the basis for our platform development. Because since it first appeared, blockchain comes with the offer of fast and secure online transactions and supports all types of data and cryptocurrency. Blockchain technology uses a system where every transaction is recorded and cannot be changed forever, so transaction security and transparency can be maintained and reduce the possibility of data fraud. Blockchain is inherently resistant to the modification of the data involved. Blockchain is a growing list of records, called blocks, connected and secured using cryptography. Each block usually contains a hash pointer as a link to the previous block, timestamp, and transaction data. Using blockchain for all our transactions will lower operating costs, increase transaction speed, create transparent and fair markets, open, democratize value distribution and narrow down relationships between advertisers, network providers and customers. Platform architecture. The platform is outlined from the beginning to be particular, so included functionalities, as they are produced, can be fused into the platform without disrupting the existing ecosystem. It is likewise advanced for a simple rollout at both the undertaking and individual levels, making it appropriate for use in vast, settled institutions and in addition little, autonomous clinics. dClinic's platform will involve the following 9 basic features. dClinic Data Exchange Layer, dClinic Blockchain Apps, dClinic Data Lake, dClinic App Store DAS, dClinic Dashboards, Platform Intelligence, Analytical Engine, dClinic Reward System, dClinic Feedback System. The team dClinic has numerous long stretches of involvement in the healthcare segment, and it is obvious from our various overall implementations that the patient ought to be at the focal point of their care. Our proposal is that by influencing the shared care to design the fundamental consumer and clinician gateway for getting to a consumer's clinical and non-clinical data, dClinic will considerably help the healthcare division by giving the care team precise and ongoing data that comprehensively identifies with the patient, in this way driving better healthcare results. dClinic's platform v1.0 has been a result of over 2 years being developed. It is by being demonstrated in Australia, Indonesia, Brazil, US and Singapore. The point is to build up a platform that can convey the dClinic vision. This token sale is to take the present infrastructure to a completely blockchain-empowered platform for genuine patient-driven care and to authoritatively dispatch in Indonesia, a noteworthy developing business sector. Token sale. Token DHC. Price 1 DHC equals $0 and 10 cents. Platform Ethereum. Accepting ETH, BTC, soft cap $20 million, hard cap $50 million. Country Singapore, whitelist Kike whitelist, restricted areas USA. Conclusion. dClinic, an incredible platform, provides a shared care model where the patient is at the center of their care and the care is provided by care team members who could be providers, clinicians, specialists, organizations and even family members. The platform puts the patient at the center of their care and does not allow brick walls to constrain their access to care. By utilizing the blockchain technology, it gives rewards to consumers for their participation and adherence to their care plans. By introducing a new model of healthcare which encourages collaborative efforts for positive healthcare outcomes, the dClinic is poised to disrupt the healthcare industry. Website https://dclinic.io